The Alberta UCP government plans to cut up to 11,000 jobs in health services. Health Minister Tyler Shandro says the cuts will not harm the province's pandemic response. Most of the cuts will come through outsourcing services such as lab work, laundry and housekeeping, not among frontline staff. Still, healthcare workers are threatening to walk off the job in protest. We did ask to speak to Minister Shandro about this plan. His office declined our request. We have reached Rachel Notley, though. She's the leader of Alberta's NDP, and she's with us from Edmonton. Hi, Ms. Notley. Good to see you as always.
Good to see you as well.
I know that you're critical of today's announcement from the government, but the government, Minister Shandro, is insisting that many of the jobs are going to be outsourced. Why is that a bad thing? Like, why do those employees have to be government employees?
Well, first of all, what we know from the literature and what we know from the tragic experience that we've observed over the last 6 months is that private sector delivery of critical healthcare services is well below that of what you would get in the public sector under the best of circumstances. And what we've seen across this country, of course, is people call for more public funding, delivery, and oversight of long-term care, and instead in this province they're running absolutely in the wrong direction. But the other thing to remember is that those 11,000 people won't be replaced by 11,000 people. They'll be replaced by private contractors who attempt to do much less in order to pad their bottom line. And even if that's not what happens, this represents a profound level of chaos being introduced into our healthcare system in the middle of a pandemic. And Tyler Shandro and Jason Kenney are simply not telling the truth when they suggest that these people are not critical frontline service providers. Of course they are. Nobody who's been in a hospital with a loved one, who's watched someone come in and clean up vomit or bodily fluids would ever in a million years suggest that those people are not frontline healthcare providers, and it is profoundly disrespectful of this UCP government to those important workers on behalf of Alberta.
I take that point completely. It doesn't seem to me that they're arguing, though, that those services shouldn't exist. They're just arguing that they shouldn't be paid for by the government. And I take your point on, for example, the difference between public and private healthcare delivery and long-term care homes. But this isn't exactly that, right? This isn't assessing the delivery of healthcare. It's services around it.
Well, they're inextricably linked. When you look at the number of outbreaks that we have in healthcare centers across this province as well as across the country, the fact is that infection control, housekeeping, the preparation of food, those are critical roles. Laundry, all those things. So in fact, they are part and parcel of it. And moreover, just the simple restructuring of it, when cleanliness and infection control is so critically important to suddenly have 11,000 people leave and usher in 11,000 new people, it's stupid, Vashi. It's just stupid.
They point to the examples of medical linen in Calgary and Edmonton already being provided by a private company. Private company provides lab services for Edmonton and northern regions. So the system already exists to a certain degree. They argue that this will amplify that and bring about $600 million of savings over 3 years that they can then reinvest in frontline healthcare.
Well, I think, first of all, the $600 million that they are suggesting will be saved from this is actually not from this particular move. The amount of money that they might save from this is more like $200 million. The other $400 million comes from jacking up fees on seniors in long-term care, asking them to pay more for home care services, and then also rationing down the work of nurses. So this will maybe save about $200 million. It's really what this is this is not about efficiency. It's not about saving money. It's about the relentless, extremist pursuit of Americanizing healthcare as much as they possibly can in the province of Alberta. It doesn't create the same level of care. It undermines that care, in fact. And right now, again, in the middle of a pandemic, it is profoundly chaotic and disruptive. And again, the people of Alberta were told that this kind of thing would not happen. Jason Kenney promised he wouldn't do this, and he's breaking that promise, and he's also putting 11,000 people out of work.
I certainly understand your point on timing. I've listened to some of the defense that they have mounted around this, and they argue that you and your party, while you're criticizing them of being kind of beholden to private interests, that you're beholden to union interests, and that your defense or sort of your criticism of this is based on wanting to protect union jobs and your party wanting to represent those unions' interests. What do you say to that?
Well, first of all, even if that were true, I think I would then be in line with the new Conservative leader, Aaron O'Toole, who himself has been spending some time talking about the value of unions and union workers to communities and the people they serve. But separate and apart from that, what I'm talking about today is the jobs of 11,000 people, a disproportionate number of whom actually live and contribute to economies in rural Alberta. I'm also talking about stability and consistency and something that is absolutely desperately needed within our healthcare system right now. This is as I say, this is a political, ideological pursuit at the most tone deaf of times, being introduced by a government that clearly doesn't care about the people it's been elected to serve.
The government says that these cuts aren't happening immediately, and I know that the big concern is obviously that this is happening during a pandemic, that instead it'll be spread out over a period of time. Do you have any more information on that?
We don't, and of course neither do they. So all they've really managed to do is scare 11,000 Albertans, and as well as many people who work with them, alongside them within the healthcare system. And let's also be clear: the actual original number was 16,000. It included 5,000 clinical frontline workers. Today, Tyler Shandro refused to commit that those people would not ultimately be fired after the pandemic. So we're actually talking about a bigger group of people. And in any event, again, the whole country is recognizing the importance of the work that all these folks do within our hospitals and healthcare settings to keep people safe and healthy, and doing everything they can to increase the quality of their work and the safety of their work. And this stupid government, honestly, is running in the opposite direction. And it is the exact opposite of what, again, Jason Kenney promised Albertans. And it flies in the face of what anybody who cares about protecting the health and safety of Albertans would want to see.
That is not something that we're used to hearing, that kind of language about, political rivals. Is that a fair characterization? I mean, they obviously have different beliefs and different ways of going about things than you would, but does that go too far?
I don't think so, because, we do. You're quite right. We have different beliefs and different values. They want to tear down government. They want everything to be delivered by the private sector. We, of course, think that there are certain cases where the public sector does as good or better a job. But the playing out this debate in the middle of a pandemic, when our healthcare system is under stress, when we are in the middle of an upswing of cases, when folks need to know that their healthcare system is there for them when they need it and that they can count on it to be a place where they are safe, not to become, in fact, a super spreading location. Playing it out during those circumstances, no, I'm sorry, it is stupid. It just is that.
I get all that, but I get all that, but there's also a massive deficit, right? And I understand that it's a pandemic and that our power panel is discussing it. If this happened anywhere else, there would certainly be a lot of scrutiny placed on those decisions. But Alberta faces, we all face big deficits. Alberta faces a uniquely huge one per capita. Mm-hmm. Could that not also be motivating them, not just sort of this naked interest in privatizing the system as you describe it?
Well, again, as I've said many times, first of all, this is a government that has actually accelerated and moved faster on a $4.7 billion corporate handout, which as a result of that acceleration, it will actually cost more. And in addition, as I've said before, their own documents suggest that out of a $15 billion budget, this might, in 3 years, save $200 million. So it's not about managing the deficit. It's not about that at all.
Okay, I'll leave it there. Thank you, Ms. Notley. Appreciate your time this evening, as always.
Thank you.
Rachel Notley is the leader of Alberta's NDP.
When fully implemented, contracting out will result in 9,700 positions being shifted to the private sector delivery. These changes will save up to $600 million annually once they are fully implemented.
That's Alberta Health Minister Tyler Shandro on the province's plan to cut up to 11,000 jobs from Alberta Health Services. It was part of a plan before the pandemic to overhaul Alberta's healthcare system and save money. But even if doctors and nurses are protected, how will Albertans react to thousands of healthcare jobs being outsourced to the private sector, especially during a pandemic? I'll be speaking with Alberta NDP leader Rachel Notley next hour. But right now I'm here with the Power Panel, Kelly, Françoise, Corey, and Supriya. Kelly, I'll start with you. I should note that we also requested Minister Shandro for the show, but his office declined. Tell me a bit more about what exactly this announcement is and how it's being received.
This stems from a report that has been long coming. We've known about it for months. And again, what is surprising in Alberta is the way that the United Conservative government has gone ahead with the moves it was planning even before the pandemic. Alberta is obviously, the Alberta government is stuck between a rock and a hard place in many respects. There is a budget deficit that is on a per capita basis much higher than any other province. There are major fiscal problems that the province is grappling with at the same time as the pandemic. And the Kenney government has really gone ahead with a plan that it articulated even in the election last year of cutting spending in this province to a large degree. That has continued during the pandemic. And what we're seeing today is the outcropping of a consultant's report that proposed major cuts, 16,000 jobs. I think we're hearing about 11,000 jobs that are going to be cut now. It's not as bad, it's not as severe as it was. It's still pretty dramatic. There is a promise not to cut any nursing jobs during the pandemic, but given that this government has really there is no love lost between healthcare workers and this government right now. It is taking place right in the middle of a medical emergency. It's really something to behold.
Yeah, I think there's a lot, Françoise, to be discussed on either side of the argument. I think they say it's going to save $600 million over 3 years, that it'll be outsourced, that the money will go back into frontline healthcare delivery. But at the same time, these are people who are delivering, if not doctors and nurses, other healthcare services during a pandemic. Like, the timing is why we're seeing these massive headlines today.
You take the words out of my mouth. I was going to say, in politics, timing is everything. And kudos to the Alberta government to dare in time of pandemic to even consider this. I mean, I can just picture if my government in Quebec would try something like that, it would be absolutely a war in the trenches and so on. So, but the labor lawyer in me kind of smell, even though I'm not a specialist on Alberta politics, there's a big battle between maybe some union jobs trying to privatize certain things. It's just the timing, Vashi, that really stinks right now because it looks so weird. I think people would understand more if the government would say, hey, listen, let's go knock on the door, which they already did for the transfer in health from the federal government. That might be a better solution. You have to sell it also. When you do big changes like this in an organization at different levels, you have to sell those changes, do some changes management. I don't feel that is the case. You have a minister who doesn't want to speak about it. For me, it's already a big red light. I don't know. It sounds weird.
Corey, I know that the Kenney government had signaled that they were going to look at doing things like this before. Do you find it odd that they kind of plow ahead with this stuff during the pandemic? I mean, they have had some issues over the last number of months.
Oh, for sure they have. But, I think it's been pointed out that the fiscal reality of Alberta is pretty dire. I also think that, it's too bad the minister isn't going to be on talking about this because, I think there's a very easy defense of what this is. Saying healthcare workers makes you think doctors and nurses, but is having the cafeteria staff and the cleaning crew outsourced, is that really going to affect the frontline delivery of healthcare? I think not. In fact, I think there's a very, very solid argument to be made that it puts more resources into the front care resources that people care about during a pandemic and at other times. So it's talking about marketing coups on naming of committees. Well, it's a marketing coup coup on the part of the public sector unions to call these people healthcare workers, because janitors and cafeteria workers doesn't sound as healthcare-y. So, look, I think there's a good argument to be made. It's not a new argument. This is many provincial governments have gone down the same road. Some of them, by the way, NDP governments. Like this is something that faces provincial governments of all manner trying to manage costs on the healthcare side. This is not some new path that hasn't been well trodden by other governments. So, when's the right time to do it? There's never a great time to do this, but it's also really dishonest to say that these are cuts, like 11,000 people are going to lose their job. No, 11,000 people are going to go from high-cost public sector union jobs to lower cost private sector, probably non-unionized jobs. And there's a big argument to be made about that. But let's have the argument on what the actual basis is, which is where are you going to put the money?
Yeah, I think I take all of those points, but I do think that during the pandemic, Supriya, and I'll get you to weigh in on this, it's as though the optics of this weren't considered. I think that many of us have become hyper aware of the function that people in the healthcare system perform outside of just doctors and nurses, like janitors or cafeteria workers, like people who are cleaning up all the PPE.
Those people who work in labs.
Yeah, or people who work in labs. And I'm not disagreeing that there is a very valid sort of conversation to be had about outsourcing it versus, what should they be government workers? It just feels like it could have been anticipated that would be a heightened conversation or debate in the middle of a pandemic.
Yeah, and I mean, to everybody who's made the point already on the panel, I mean, the optics of this couldn't not be worse in the middle of a pandemic. And as Françoise was saying, if this had happened in Quebec, I mean, if this had happened in Ontario, it would be full-fledged war in the trenches, to use her exact phrasing there. I think Corey does have a point with respect to people should read past the headline and maybe, beyond the first lead graph or whatever there is. But, once you dig down to it, if you're talking about some of the ideological bents that some of the unions and the public sector unions have been, raising, I think there is cause for concern and there is reason to worry. And I mean, right now, people all of a sudden know a lot more about the resources that go into labs and laboratory testing and the differences between different types of testing and just resource intensive is. And so, you can say that they're just custodial staff or it's just cafeteria staff, but I mean, that's not the case. There are also going to be, lab services that will end up taking a hit on this. And I think that should be a concern. And I think just more, widely and more generally, I think voters should take a lesson from this and learn that whenever governments in waiting or prospective parties are talking about making serious cuts or to a budget because, deficits or debts are unwieldy and need to be taken under control, the two biggest line items any provincial government has are education and healthcare. So that's exactly where it's going to come from. And I think we need to have an honest conversation about that going forward.
Okay, well, I'm sure we will here on the Power Panel. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.